Let me make sure I'm going live. Okay. Hi, so this is Dr. Isabelle Amigues, your friendly rheumatologist. And we are going to talk about auto-inflammatory syndrome. Those lives are educational. They are here for you. My goal in rheumatology and in doing those rheumatology lives is to really empower patients so that they understand everything that's happening to them, and they can get a little sense of what's going on into their lives. Okay, so some of the questions that I've had recently, and it actually was with my patients, they were asking me, what's the difference between an auto-inflammatory syndrome and an autoimmune syndrome? And it is such a good question. And what I can tell you is that not everyone understands this. As medicine, like in medicine, doctors, they don't necessarily understand this. I would almost argue that some rheumatologists don't necessarily understand this, and you are going to, at the end of this 10 to 15 minutes, you will understand the difference. Okay, so what is an auto-inflammatory syndrome? I like to take example. Remember, I used to give a lot of example, and I'm going to give you one actually. I think that's really valuable. So the typical case would be someone with something that's called Still's disease. And Still's disease is an auto-inflammatory syndrome, and this is how it would present, right? And it doesn't necessarily have to present like this. This is just one example. So it would be a young patient, maybe like in her 20s, that develops joint pain that's inflammatory, so worse in the morning, associated with morning stiffness, maybe some swelling. She also has some fevers, that she feels like there's fevers. She may have some abdominal pain and a rash that really doesn't she doesn't pay too much attention to it, but she has a rash. And what she's realized is that it's been many years. She has those moments of flares where she would have the joint pain, the skin rash, as well as those abdominal pain and fevers. And basically those symptoms would basically put her down, and then she would have no problem. Maybe she's taken some ibuprofen to stop those problems, and then she stops, right? And this is one of the ways that an auto-inflammatory syndrome presents. So another example would be someone that has abdominal pain that's very severe, and that can even have some blood in the stool. And same thing, it's cyclic. So she has abdominal pain, fever, blood in the stool, in a cyclic pattern. And so it's just like there are moments that there's no problem, and there are other moments where it's really annoying, right? Like really bothersome, and it's a she or a he really, and puts them down, and they think that it's an infection, maybe because it doesn't happen that often, and it happens maybe once a month or maybe once every 2 months. And those once every 2 months cannot really function as this. Maybe take some anti-inflammatory such as ibuprofen, feels better, and then forgets about it until it keeps coming back, and until one day the person feels like, is this normal? Like what's going on here? Okay, so this is actually auto-inflammatory syndrome. So that I presented to you an example of Still's disease. Another example was familial Mediterranean fever. I've had patients with something that's called TRAPS. I've had also patients that have presented with very severe symptoms. Some other ones where it really wasn't that severe, and it took many years to make a diagnosis. Okay, so that's just to give you an example of how it can happen. And then what's the difference between an auto-inflammatory syndrome and an autoimmune disorder? So an autoimmune disorder such as rheumatoid arthritis, lupus, mixed connective tissue disorders, scleroderma, Sjogren, those are the immune system. So right, like it's the immune system that's adaptive, like, right? Like, so we need to make cells that are going to affect, like basically the B cell are making cells, and those cells are creating antibodies against our own component of cells, and that's what's causing the issue. In an auto-inflammatory syndrome, what's happening is that it's the innate system, right? And it's an inflammatory reaction that's not because of your cells that are creating antibodies, right? And so usually the auto-inflammatory syndromes, they are due to some genetic predisposition. So usually when we really go deep, we realize that these symptoms also happen to the father or to the mother, to the grandmother, to the grandfather, right? And so we can actually almost pick up that there is this familial hereditary syndrome, right? And that's how we think about this, right? And the truth is that it's a spectrum, but it goes from auto-inflammatory to pure autoimmunity. The pure auto-inflammatory syndrome have a ton of fever because that's what our inflammation. So basically, it's this sort of, how do I explain this? It's kind of like a snowball effect of inflammation. Some like there is, and that's exactly how our patients are sharing that they are feeling, right? It's basically suddenly out of the blue, just one symptom becomes like 2 symptoms, 3 symptoms, 4 symptoms, and it just keeps like worsening, and people are feeling extremely inflamed. All right. That is a little different than an autoimmune syndrome, where it takes a little bit of time to really have a full-blown autoimmune disorder, right? And usually people are like, well, I had Raynaud's phenomenon in the past, or maybe I had a little bit of rash in the past, and or maybe I had a little bit of joint pain in the rash. And it just kind of like, build up on each other until one day it was full-blown autoimmune disorder. The auto-inflammatory syndrome are going to be just sort of an on-off switch, because just the way it presents, the way the pathophysiology, like the reason why it's happening happens. And so the way I explain the autoimmune system to my patients is that there's 2 ways. Like there is the very sophisticated way that's makes antibody. That's what we use when we are giving vaccination, and it takes time to build. And then so that's the B cell and so on. And then there is this other system that is much more reactive and really fast, but also not as sophisticated. And because it's not as sophisticated, it doesn't actually looks at, is this abnormal, is this normal? Like I mean, it does, but not as specific, right? And so that's why you may have a lot of inflammation. Basically, that's what causes this inflammation. Okay, now how do we make a diagnosis of autoinflammatory syndrome versus an autoimmune disorder? Usually in an autoimmune disorder, you have antibodies that are positive. So you'll have a positive ANA, you'll have a positive dsDNA, rheumatoid factor, CCP, and so on. But I think the most important thing to me as a rheumatologist is the fact that in an autoimmune disorder, you may have a little bit of flares, but if you don't do anything, the patient keeps just getting worse, or at least bad, right? Whereas in an autoinflammatory syndrome, it's kind of like gout. And gout actually, like, it's kind of like the same cell system that's happening when we have gout. It's that you're going to have severe symptoms, then no symptoms, severe symptoms, then no symptoms. And like the real question to ask is to say, is there any moment where you have none of those symptoms and you don't have to take anything? And very often, if the patient says, oh yeah, absolutely, there are moments where I'm totally fine, then you are like probably in an auto-inflammatory syndrome. So where it becomes a little bit complex is that I was telling you, if it's autoimmune, they usually have antibodies, but you can still have autoimmune without antibodies. And same thing, you can have an autoinflammatory syndrome with antibodies, and the ANA is specifically something that you can have. But in general, then what blood work do you want to look at? And if you don't have a rheumatologist, I would say just, pick up this. Those are actually quite interesting. So you are going to check inflammatory markers, or CRP, and sedimentation rates, right? Erythrocyte sedimentation rate, so ESR and CRP. And then the other one you want to check is a ferritin level. If you have a very high ferritin level, we're probably talking about an auto-inflammatory syndrome. And that's really something that you want to look at, right? Not everyone that has an autoinflammatory syndrome will respond, like will have a high ferritin level. But if you have a ferritin level that's really high, that's really something that you're like, okay, something's going on and it might be an autoinflammatory syndrome. Okay. Other blood work is an elevated white blood cell. That's possible. So if you have an elevated white blood cell and something, it's cyclic and it's recurrent, that's something that I find is very interesting. And the other thing that you could look into is that, do you respond really, really well to anti-inflammatory? So we were talking about ibuprofen, naproxen, diclofenac, all of those, right? Do you like, does it feel like you have a switch on and off with those? And then the second, if you have access or if you can ask your primary care physician to offer that to you, is do you respond to colchicine? And so you have heard me talk about colchicine in patients with gout or pseudo gout. And the really cool thing is an autoinflammatory syndrome. So that means that it's an inflammatory, it's the inflammasome. It actually has a name. That's the issue. And colchicine works really well for that. So you can actually use colchicine to also help with anti-inflammatory syndrome. And good news is really treatments are not much different except for that. Then after, it's kind of the same treatment than rheumatoid arthritis. So you would actually potentially use methotrexate, and then you would use a biologic agent. And very often our patients use TNF inhibitor first. So that works for anti-inflammatory syndrome. I also really like IL-1 inhibitors as anakinra because that really acts directly into this autoinflammation. Okay, hopefully this makes sense to you. Don't hesitate to tell me, hey, I want to learn more about specifically this disease or that disease, right? And if you're watching this on replay, please put hashtag. If you haven't subscribed to the Rheumatology 101 channel, please go and check it out. Rheumatology 101 by Dr. Isabelle Amigues, Amigues. It really means a lot if you could subscribe, and then share this episode with someone you think is going to enjoy it. And as a reminder, we have a website called positiveana.com. So if you have any question about Positive ANA, I'm starting to put quite a bit of videos there, and that can be helpful to you. And hi, Rockdoc. So you're mentioning that you have a family links. There's a lot of family links into autoimmune and autoinflammatory syndrome. And what's really interesting is you mentioned that your sister has ulcerative colitis. And if you actually look into this, you know, the autoinflammatory here and autoimmunity here, the ulcerative colitis is actually a little bit it's actually closer to the autoinflammatory. So it is possible that there is a gene mutation somewhere in the family that, by the way, can give you an additional good thing, right? Like, it doesn't have to be always negative. So yes, you may have ulcerative colitis, like your sister may have that, maybe you have vasculitis, and maybe someone in the family has something else. And that, you know, you have had some gene mutations, but that's okay, because maybe that gene mutation has also added some benefit to you. And I think we forget this as well. And where I stand personally is that we have treatment for ulcerative colitis, for vasculitis, for all of those for all rheumatologic disorders, we have treatment. So it's really just a matter of finding what it is. Okay. And then, hi, Dr. Valerie, such a pleasure to have you here. Hi, Maggie, and hi, Nicole. Hi, Tosia. Hi, Paula, and hi, Rockdoc. And then, yeah, again, if you're seeing this on replay, I would love to say hi later. So have a wonderful day. We'll talk more next week, Tuesday. Until then, I hope this was helpful. Don't hesitate to share. And I wish you an excellent week. Take care. Bye-bye.